Quizlum.com is a trusted website that provides access to real exam questions. These genuine questions are collected from recent exams through our tutors and test takers who bypass proctored software to complete exams safely. After completion, the actual questions are uploaded on Quizlum.com along with teaser videos. If you want to memorize real questions and answers before your exam, purchase the relevant exam package on Quizlum.com and start memorizing the answers on your fingertips. At Quizlum.com, you get the most repeated real exam questions. No practice questions, only actual exam content.
In this video, I'll be sharing the most repeated real HESI Exit Exam questions along with their correct answers. Get ready, because you're very likely to see these on your actual exam. Let's begin. Question number 1. The nurse is developing a teaching plan for a client with acute gastritis caused by drinking contaminated water. The nurse should emphasize the need to report the onset of which problem? Option A, bloody emesis. Option B, bruising of the skin. Option C, abdominal cramping. Option D, low-grade fever. Explanation: bloody emesis is the correct answer because hematemesis signals active gastric bleeding from mucosal erosion and needs urgent evaluation. Cramping or low-grade fever is expected and less emergent. Question number 2. A client reports passing 2 to 3 small, hard stools per week since being placed on a low-residue diet 3 months ago. Which type of laxative should the nurse expect the healthcare provider to recommend first? Option A, osmotic. Option B, emollient. Option C, stimulant. Option D, bulk forming. Explanation: bulk forming is the correct answer because bulk forming agents, for example, psyllium, safely restore fiber and stool bulk and are first line for chronic constipation. Stimulants or osmotics are typically second line. Question number 3. A client arrives to the emergency department with chest pain after taking sildenafil. Based on the client's history, which medication should the nurse withhold? Option A, morphine. Option B, heparin. Option C, aspirin. Option D, nitroglycerin. Explanation: nitroglycerin is the correct answer because nitrates combined with PDE5 inhibitors can cause profound refractory hypotension. The other listed meds don't share this dangerous interaction. Question number 4. The nurse is planning a class about blood glucose monitoring for a group of clients with diabetes mellitus. Which timing of glucose testing would apply for any client regardless of the client's age or type of diabetes? Option A, during acute illness. Option B, immediately after meals. Option C, before going to bed. Option D, prior to exercising. Explanation: during acute illness is the correct answer because sick day rules apply to all diabetes types. Illness raises stress hormones and glucose variability, so more frequent checks are universally recommended. Question number 5. Which snack selection indicates to the nurse that a school-age child with gastroesophageal reflux understands the dietary restrictions? Option A, sugar cookies. Option B, tacos. Option C, chocolate milkshake. Option D, pizza. Explanation: sugar cookies is correct answer because low-fat, non-spicy, non-chocolate items reduce reflux. Tacos or pizza are high-fat or spicy, and chocolate relaxes the LES, all worsening GERD. Question number 6. Which assessment should the home health nurse include during a routine home visit for a client who was discharged home with a suprapubic catheter? Option A. Measure abdominal girth. Option B. Observe insertion site. Option C. Assess perineal area. Option D. Palpate flank area. Explanation. Observe insertion site is the correct answer because the suprapubic tract or skin requires routine inspection for infection, erythema, leakage, and securement issues. This is the priority check each visit. Question number 7. Which laboratory values are critical for the nurse to monitor for a client who is experiencing a thyrotoxic crisis? Option A. Electrolytes and hemoglobin. Option B. Glucose and calcium levels. Option C. Renal and liver function tests. Option D. Blood and urine cultures. Explanation. Glucose and calcium levels is the correct answer because thyroid storm drives hypermetabolism, causing hyperglycemia and bone turnover that may elevate calcium. Both can be dangerous and guide urgent management. Question number 8. The nurse completes percussion of the abdomen on an older adult client. Which finding is considered normal for this client? Option A. Pain. Option B. Absent sounds. Option C. Musical and drum-like. Option D. Tenderness. Explanation. Musical and drum-like is the correct answer because normal gas-filled bowel produces tympany, a resonant, drum-like note on percussion. Pain, tenderness, or silence suggest pathology. Question number 9. The nurse is caring for a client who receives a prescription for parenteral lidocaine. Prior to administering the medication, the nurse should review the medical record for which condition? Option A. Heart block. Option B. Glaucoma. Option C. Gastric ulcers. Option D. Diabetes mellitus. Explanation. Heart block is correct answer because lidocaine class IB antiarrhythmic depresses conduction and is contraindicated in AV block without pacing, risking severe bradyarrhythmias or asystole. Question number 10. The nurse is teaching an older client about the prevention of osteoporosis. Which foods should the nurse recommend to the client to increase in the diet? Option A. Water and herbal teas. Option B. Fresh fruits and vegetables. Option C. Iron-rich meats. Option D. Low-fat dairy products. Explanation. Low-fat dairy products is the correct answer because low-fat dairy supplies calcium and often vitamin D, essential for bone mineral density and fracture prevention in older adults.
In the end, let me share a top secret with you. So, if you don't have a time to study or not confident in passing exam, then either you can purchase real questions from our website, Quizlum.com, or fill out our exam, help request form in the description, or comment of the video to have our technicians take the exam for you, using our secure, undetectable software. Payment is only after exam completion, with a guaranteed A or B grade. Happy success!